Welcome back, future medicos. Finally, Telangana has released the round one seat allotment for management quota seats as well as competent authority quota seats. In this video, I will be discussing more about the management quota seats in Telangana. So I will cover the category B seats for local candidates as well as other state candidates. I will be covering the minority colleges as well as non-minority colleges. I will be covering colleges that are catering only for women candidates. Come, let's go and see all the details. So first, we will be looking at category B, unreserved. Unreserved means the seats that are available for other state candidates. Open means non-minority seats, non-minority colleges. And then general. General means everybody can compete. That is both boys and girls, right? So there are four filters. One, category B seats. Unreserved, that is basically category B1 is what we are discussing. Non-minority colleges, and then colleges that are available for everyone, right? Co-education college. So let's look at the cutoff marks. At number one place, we have Apollo Hyderabad, which closed at an All India rank of 58,578 and a NEET score of 617 marks. So this is the college that has the highest closing score for category B1. At the second place, we have Kamineni Academy, Hyderabad, which closed at 604 marks. Mamta Academy, Bachipalli, closed at 601. Bhaskar Medical College closed at 595. Medicity closed at 588. Mamta Medical College, Khammam, closed at 587. Kamineni at Narkatpalli closed at 583. Arundhati Institute closed at 582. SVS Medical College closed at 580 marks. And at number 10, we have Pratima Institute of Medical Sciences, Karimnagar, which closed at 573 marks. At the 11th position, we have Maheshwara Medical College, which closed at 573 marks. At 12, we have Dr. Patnam Mahendra Reddy, which closed at 572. CMR Institute closed at 569. MNR Medical College closed at 568. Mahavir Institute closed at 567. C. Anandarao Institute of Medical Sciences closed at 566. RVM Medical College closed at 566. Surabhi Institute closed at 561. Pratima Relief Institute closed at 560. And at number 20, we have TRR Institute of Medical Sciences, which closed at 559 marks. At the 21st position, we have Father Colombo Institute of Medical Sciences, which closed at 558 marks. And finally, we have one private university. The 21 I showed you are self-financing private medical colleges, whereas at number 22, we have a private university, which is Nilima Institute of Medical Sciences, which closed at 501 marks. So the self-financing private medical colleges for other state candidates, that is the open seats, closed at an All India rank of 1,27,000, which is an equivalent NEET score of 558. Whereas for the private university, it closed at an All India rank of 2,03,000 with an equivalent score of 501 marks. So this is the open seats for other state candidates, that is category B1. Now let us look at the minority seats. So minority colleges, that is once again category B1. Minority colleges, we have three minority colleges. Deccan College of Medical Sciences, which closed at 591 marks. Shadan Institute closed at 571. Ayan Institute closed at 553 marks. So not a big difference between minority and non-minority for category B1. It's more or less similar kind of closing score, and not big difference you could see. You could see that 558 for the non-minority, whereas for minority, it closed at 553, about 5 marks difference. So not a big difference, I would say. Now, within the minority colleges, let's look at the female or women-only college, which is Dr. VRK Women's Medical College, which closed at 552 marks, right? Just 1 mark below the general open seats. For women, it is 1 mark lesser. So that's the cutoff marks for other state candidates, right? These are all the different closing scores for other state candidates. Now let us look at the local students. For the local students, what are the different cutoff? Let's see. So for category B, local students, open seats, that is non-minority colleges, and then co-education colleges we are looking at. Certainly the cutoff is very, very low compared to other state candidates because of the local reservation. Once again, Apollo Hyderabad is at the top with 519 marks. Kamineni closed at 488. Mamta closed at 478. Bhaskar Medical College closed at 455. SVS at 447. Kamineni Narkatpalli closed at 423. Mamta closed at 422. That is Mamta Kamam. Medicity closed at 413. C. Anandarao closed at 408. RVM Medical College closed at 386. At number 11, Pratima Institute Karimnagar closed at 385. Dr. Patnam Mahendra Reddy closed at 383. CMR Institute closed at 381. Arundhati Institute closed at 375. MNR Medical College 372. Maheshwara Medical College 364. Mahavir Institute 358. Pratima Relief Institute 356. Surabhi Institute 345 marks. TRR Institute of Medical Sciences closed at 343 marks at number 20. Then at number 21, we have Father Colombo Institute, which closed at 341 marks. So for local candidates, that is category B, B2, I would say, the closing all India rank for self-financing private medical colleges is 5,03,000, which is right, very, very low compared to the other state candidates. Of course, right, local candidates need some preference, and I don't mind that. So 341 marks. So compared to local students and other state candidates, there is a difference of about 200 marks. Coming to the private university, which is Nilima Institute, which closed at an all India rank of 5,05,000 and a NEET score of about 341 marks. Now let us look at the minority colleges for local students. For local students, the minority colleges, Deccan College closed at 449. Shadan Institute closed at 415. Ayan Institute of Medical Sciences closed at 338. Once again, not much difference between minority and non-minority, only about 3 marks different, 338 and 341. Let's look at the women's only minority college, which is Dr. VRK Women's Medical College, which closed at a score of about 361 marks. So minority colleges, the closing score is about 338 marks. I'm not sure whether all the NRI seats had been allotted or whether there are any unallotted seats. So I don't want to show the cutoff for NRI seats because without knowing whether all the seats had been allotted, it may not make sense to show the cutoff marks. I hope the information I've shown in this video might be useful to you. Thank you. Bye-bye.